Hi, everyone who's watching this. My name is Isabel. I'm head of product at Guava Health, and today I have the pleasure of interviewing Jenna. So, without further ado, Jenna, do you want to introduce yourself?
Yeah, my name's Jenna. I have a lot of chronic conditions, but I also have worked in healthcare, and so I think that really gives me a great perspective into both sides of the experience, and also just being able to see what really goes into working on the provider side and also the experience on the patient side. As a patient, it's often very frustrating. There are a lot of long waits in healthcare. There are a lot of complicated processes that often don't really make sense to a patient, and it just makes the whole process a lot less convenient. And I think working on the other side of that, I've really seen what goes into everything, and that doesn't make any excuses for some of the things that happen, but it definitely helped me understand and be able to work with those companies and work with the provider side to see how we can actually improve those processes to make the experience better for patients.
To dive into your personal journey, if you will. So, before your diagnosis, what were the main challenges that you felt like you were facing when navigating the healthcare system?
So I think a big thing when you have chronic conditions is that there are so many different puzzle pieces, and it's so hard to keep track of them, especially when you're seeing all these different specialists. And oftentimes they're a new specialist, so they don't know your history.
Mm-hmm.
So, really, my biggest challenge was keeping track of everything. At one point, I started to use a binder. So, it was this huge, heavy binder of a bunch of papers. So, not only did I have to track down and scan everything, but when I would go to a new doctor, they would have to take the binder, scan each and every paper, and they were always asking about individual symptoms. And that was the one thing that I didn't have my records were like lab tests and small summaries and my vitals from when I would see a provider. And I was being asked about my symptoms, and all I could do was tell them what came off the top of my head, which
Mm-hmm.
was often skewed based on how I was feeling that day, maybe how I was feeling that week. So when I got diagnosis, my doctor told me to use a spreadsheet. And that was the first time I really heard of that type of symptom tracking. So I did start to use a spreadsheet. I would, track every day the symptoms I would have. I would rank them on a scale from 1 to 10, write down the time that they would start. And then I started to develop my own way of doing it based on my own experience and the things that I was experiencing on a day to day basis. But before I had a diagnosis, no one had guidance for me on how I should keep track of those things. And especially because it was all an unknown, I didn't have a diagnosis, so I couldn't really look that up. I know I one time saw a neurologist for some headaches, and he had his own headache tracker, and that was for a very specific symptom, very
Mm-hmm.
specific set of conditions. But for what I had, which at that point was unknown, there was no guide to tell me what to do.
Why do you think that it took you getting a diagnosis for any of your, handful of providers that you had been seeing up until that point to recommend tracking your symptoms?
I think there are a few reasons. One being I didn't even know how to present my symptoms. I think for so long until I did get a diagnosis, I had been experiencing those symptoms for so long that I wrote them off as being normal. That
Mm-hmm.
was my baseline. Honestly, when I got diagnosed and I started bringing up some of these symptoms, even my parents were like, wait, you have that? Like, you have headaches every day, you have stomach aches every day. How did we not know? And it was just because I kind of thought they were normal at that point. I'd been experiencing it for so long. I assumed
Yeah.
that was what everybody experienced. I didn't really want to be like the girl who cried wolf, so I just didn't talk about it.
Yeah. Do you think that that's something that's a common, I guess, barrier to getting an earlier diagnosis where the baseline for people has just been so shifted and they're like, oh, these symptoms that I experience every day are super normal and so I don't track anything. And then when I go see providers, it's like the things that come top of mind to me, but not actually the puzzle pieces that will help solve the problem.
I think it definitely is. And I think it also affects when providers ask things like, can you rank the pain on a scale of 1 to
Yeah.
10? Or that's the most common one, but asking for other symptoms in the same way, because they're asking on a scale that they understand that that's not how the patient is living their daily life. They're not experiencing pain one day and being like, my pain is a 7 right now. It's more about how it's affecting their life. And so when providers ask, how is this pain affecting your life, as opposed to, can you rank this pain on a scale of 1 to 10, that's a much better way of communicating and really understanding what the patient is going.
Yeah. Do you think that there was a particular moment in time that kind of flipped the switch from you trying to get a diagnosis to actually getting a diagnosis? Like, was there something, some event or something that you did that really changed that trajectory?
Yeah, I think I've always been very self-aware, and that's definitely helped me in being able to accurately communicate what I was experiencing to the providers I was seeing, and also my motivation and my drive to really get there, and also being self-sufficient in the way that I was managing my health. I think where it really changed was over the years I've started to recognize a pattern, and I think that's another important thing in being able to track symptoms and track things like that is like finding a pattern at the center, because that's really grounding what you're looking at. And I started to see a pattern, and I had brought it up to a couple of doctors who had basically shut it down. They basically said, there's no way you'll ever find one thing that explains everything. Like, stop kidding yourself, basically. But I just I knew there was something, and I had pretty good intuition about other things in the past. And so I just wanted to keep pushing forward with that. And I think there was a point mentally where I just went, I am going to push extremely hard for this and just see where it goes. And I think after that, honestly, it was a bit of luck and, happening to see a doctor that mentioned like one phrase or one word that led me to looking something up, that led me to reading some research, that eventually led me to being able to get the diagnosis. So it wasn't something that was a set path that I could tell somebody else to go and do and they would be able to do it. But I think a lot of it had to do with my mindset.
Yeah.
Because in the end, I'm the common factor. I'm the person that's going from one physician to another. It's not them. They're not going to always be the ones to say, this is the next person you should see. Sometimes that's on me.
Yeah. Out of curiosity, before we move on to the next section, how many doctors do you think that you saw, or a provider of any kind, that you saw prior to getting a diagnosis once you started experiencing symptoms?
Probably over 20. Wow. I think I figured out I'd basically seen every single type of specialist.
It's like a bingo card for specialists.
Yeah, exactly. I should make a bingo card. But I've always believed that knowledge is power. And I think one of the biggest mindset shifts I had was realizing that it's not about solving or fixing anything. I remember, especially when I was younger, I used to get very upset and, talking about how I was essentially like needed to be fixed. So implying that I was broken, but that's just not how it is. And I think the moment that I realized that and started taking the journey as an exploration and something where I'm just trying to gain more information rather than trying to find out the solution or the fix, I think that helped me tremendously, because it allowed me to, one, not get disappointed, but also it allowed me to explore paths that weren't a direct solution.
Yeah.
That were more into that realm of just trying to find out more.
Yeah. So I guess that's a good segue into the next section that I wanted to talk with you about, is the role of technology in healthcare and kind of the shift that you've seen. And so I know that you've studied this in school and given a lot of thought to this. And so I'm really curious about your perspective on what you see as the role of technology in the healthcare space, and in particular from a patient perspective as well.
I love using Guava because it is designed for the kind of journey that I'm experiencing. And it does a lot of that work for me that I was having to manually do before. And as someone who had the time and wanted to, track all my symptoms in that way, I'm a very analytical person. Part of it was enjoyable. But I know for a lot of people that's not the case. And so it's not motivating enough for them to want to do that just on their own. And I think Guava makes it fun. It makes it engaging. It makes it, in some cases, rewarding, even when the journey is difficult and you're going through these challenges every day. I also think, and this is a lot of like the work I do, so this is something I definitely believe in, but I think companies that build community are so powerful. I think in healthcare, especially people with chronic conditions who have struggled to get a diagnosis, feel that lack of belonging, and
Yeah.
they've experienced mistrust, and they've experienced being sidelined, and all they really want is to feel seen and to feel supported and to feel understood. And companies that create that community in a brand, whether that's, a lot of the time it is through the way the product is designed, but also through marketing and social media, it really allows people to feel like they belong somewhere,
Yeah.
and that they have people that really understand them. And when you're using a product like Guava, I personally feel very understood. I feel like somebody really designed this for the challenges that I'm going through. And I think it just further fuels my passion for the work that I do in healthcare.
Yeah. Yeah, it's been really eye-opening, at least for me and from my perspective, to see how important from an identity perspective getting a diagnosis is. And for those many, many years leading up to actually getting a true diagnosis, and you're really just like, in the throes of flare-ups and not understanding what's going on with you, and doctors just kind of bouncing you around from specialist to specialist, like how draining that seems to be and demoralizing. And it's like there isn't that sense of community. So I think that that's like a really interesting and important perspective that people who are healthy kind of forget about, because healthy people are already part of a totally different community. So what role do you see technology playing when it comes to improving communication between patients and providers, and if you see a role there for technology at all?
I do. I definitely see a role with technology. I think the biggest problem in communication between patients and providers is this gap in the level of perception. So providers are taught a certain way to take in that information and decode the information in order to come up with a diagnosis or a next step. But the way that patients present that information is not in that same way, is not in the way that providers are taught to receive the information, because in the end, it's their real life, it's their experience, and that's often very different. And it can also change. A patient's story can change based on what they're experiencing that day, that moment, that hour.
Yeah.
And I think that so many solutions in healthcare are point solutions. They're trying to fix one small thing, one thing here, one thing there, but it just complicates it for everybody involved. And I think technologies that are bridging that gap are the most effective. And I think Guava helps bridge a lot of those different point solutions that there are out there, whether that's, data from different wearables, different EHR systems that are holding the patient's records, or even that communication aspect with some of Guava's features, like the pre-visit summaries, where a patient could look at it before, be able to add questions before they go in. And that really helps them come in from a state of, what they're really looking to get from the provider, and rather than responding and reacting in the moment to whatever question they're asking about the pains that they're experiencing.
Yeah. It's when we were building the visit prep experience, it was really interesting because we obviously did a lot of user stories, and that came from both provider perspective and patient perspective. And when we talked with patients, what it sounded like was that they would be monologuing and narrating what was happening to them and feeling like they were articulating their points very clearly. And then we would talk with providers, and they would say, we're trained to listen for specific things. For example, like, is your pain dull or aching or sharp? And it was very, specific symptoms that they were keeping an ear open for, and adjectives used to describe the symptoms. But when a patient is narrating, they don't know to use those adjectives, even if those adjectives are good ways of describing what's happening to them. And so it was really fascinating because the provider didn't think that there was that same level of a breakdown of communication that the patient was experiencing. And that was really eye-opening, because it's like you're speaking the exact same language, but you're not at all.
Yeah, I think some of the common themes that I've seen in healthcare when it comes to that kind of communication are that uneven hierarchy of power, essentially, that is ingrained in us from when we are young. And that kind of goes into this idea of paternalism that really creates, to kind of explain that, the idea of paternalism is that the provider's sort of acting like a parent role. You know, when we're very young, we're taught, we go to the doctor, we tell them our symptoms, they fix the problem. But that's not the case.
Yeah.
And it often creates a fear or worry for patients, similar to, you know, if you're like getting in trouble from your parent, or, you know, you want to always like impress your parents, you want to always be good to them. It's a similar kind of idea. And that gets even worse when, you know, providers and doctors, they're taught so much information and they hold all this information. And I think a lot of patients feel like that information isn't theirs to know, it's the providers to know.
Yeah.
And the provider is like giving them whatever information they want, and that it's not up to the patient what information they get. And I think we need to kind of decentralize that information. And I think a lot of people have tried to do that in the past with different websites, you know, WebMD, that kind of thing, and Google in general, and also on social media. But there is a lot of misinformation.
Definitely.
And I think that actually just adds more fear on both ends. There's fear to share the information, for fear that it will be perceived or understood in the wrong way. And there's fear from patients to get that information because they're not sure what's accurate and right. The real way to go about that are two things. One, to create more health literacy, to increase health literacy in people, and to also help people discern the information. We can't get rid of things like misinformation. We just can't. But what we can do is teach people how to discern that information and how to understand what's applicable to them, what's general information, and what is information that they can take in and understand and then bring to their provider and say, I know about this topic now, I've been experiencing this, how does this apply to me, what should I do going forward? And really creating the response mechanism when people hear health information that they're not sure about, they then go to somebody that has that expertise.
Yeah.
And I also think having patients and providers really understand and really reinforce in the actual interaction that the provider is really the facilitator. They don't know everything about the patient. They just have the tools and knowledge to take what the patient knows and find potential solutions and next steps. So they're not the ruler, they're the facilitator. They're just facilitating that interaction. The patient is bringing their story, bringing their information, and the provider is decoding that and then coming up with next steps.
Yeah. I think that paradigm shift is really important and definitely can lead to powerful changes in patient care and outcomes. When patients are people who understand that they are and should be an active participant in their healthcare, and then the provider, you know, paradigm shift, if you will, can circle around more of like understanding and knowing and recognizing the fact that patients are the most informed about their body, like they know their body best. And yes, you know, these providers have years and years of training and expertise, and of course, like, you should go see a provider when something's going wrong with you, but the provider should also know that, like, when someone is seeing them, it's because they don't feel good and they know that something's wrong. And so taking that extra, I guess, empathetic level of sitting there and listening to the patient, be like, okay, like, what's going on with you? Why do you think that there's a shift between your baseline of whatever you consider healthy to why you're sitting in front of me today? From your experience as a patient with complex conditions that took a while to get a diagnosis, how does it feel like providers, in your experience, tend to approach these complex cases?
I think it varies, and there's sort of three ways it can go. There's the negative experience, which is they don't approach it well, and then it doesn't end well. There's a second one where they don't approach it well, but then they start to understand, because a lot of providers just aren't used to having people that have such complex cases. And then there's really positive experiences where it's clear that the way that they work and the workflow that they have created for themselves really works well for that. So a few examples. I saw a cardiologist a couple of years ago who I came in. It was clear that he didn't know much about my condition. It was then clear that he was confused. So the outcome of the appointment was basically him telling me that he doesn't believe that I have that condition and that he can't diagnose me with anything and that there's nothing wrong, even though it was clear on one of the tests he ran. I couldn't even finish it, and a normal person should be able to finish the test.
Mm-hmm.
So it was clear there was something wrong, and he basically just wrote on the report, patient stopped due to fatigue. It was definitely not fatigue. I almost fainted. I was very dizzy. I couldn't see straight. But he was clearly confused and didn't know really what to put. So he just put the simplest thing, that I had to stop due to fatigue. So a couple of weeks ago, I went to another cardiologist, and this is a few years later. I've gotten a lot more figured out. And I started telling her my history. And she interrupted me, and she basically thanked me, because she said sometimes when she treats a lot of patients with complex conditions similar to mine.
Mm-hmm.
She said a lot of patients come in and it's very hard for her to understand what they're saying and discern the information and put it into an order that makes sense, because there's so much emotion.
Yeah.
And she wasn't saying that to invalidate any of the emotion, but sometimes you do need to come in a little bit detached from the way that you feel about the symptoms, because there's the symptoms themselves, and then there's how it affects your life, and then it's how you feel about that. And I think the first two are really useful, but how you feel about it is more secondary. Like, it's still useful for the provider because they can see how urgent it is in your lifestyle. Like, maybe you have a low level of pain, which typically would be seen as like non-urgent, but if it really affects your life and the way that you live, maybe you have a job that it really affects, that becomes more urgent. And I was also going into the whole story about the first cardiologist that I'd seen a long time ago, and I was thinking, what do you mean? I'm talking like I'm absolutely crazy. But clearly she appreciated the way that I was talking about it. And I think that part of me being able to do that is having the information I have, having the diagnosis, but also, like I said, having worked in healthcare, I understand a lot more of that. For somebody that doesn't have a diagnosis and still trying to figure things out, if they're coming in with a lens of, I think that this is my diagnosis,
Mm-hmm.
then they're probably going to leave the things out that they think are irrelevant to what they think they have.
Yeah.
And that's leaving information out that the provider can then use to actually solve the problem accurately. And so that goes into one of my really good experiences, which is that I saw one doctor who, on his intake form, asked questions about what I thought was wrong and what tests I wanted him to do and what diagnoses I wanted him to explore. So it wasn't just about hearing what I had to say, but it was about understanding the lens in which I was presenting the information in that current moment. So it was a GI doctor. So, a lot of the things I was thinking were like GI related.
Mm-hmm.
And that's a lot of the stuff I wrote on the form. And because he knew that, he started asking me direct other questions about other systems of my body, other experiences I'd had. And that's actually what led to getting my diagnosis. I go, oh, actually, I did remember one other thing that happened the other day. And I told him about how I had just gone on a morning walk and I got hives. Completely unrelated to GI, has nothing to do with food, nothing to do with my GI system. So it just proves that even somebody like me, who is very on top of all my information, very self-aware, very driven in that sense, will sometimes miss out things because I'm just not in that frame of mind. I'm thinking I'm at a GI doctor.
Yeah.
That doesn't mean morning walk. That means like food. It means,
Yeah. Yeah, that's such a good point, and it's really awesome when there are providers who who do that level of scrutiny when looking at a complex patient, if you will. Something that we included in the visit prep, actually, from talking with providers like this one, is we added a section that's specific, like what you think is going on with your body, what are your hypotheses, and then on top of that, labs or action items that you want to discuss with the doctor, whether or not it makes sense based on all of the symptoms that you're presenting with, not just the symptoms that are specific to a cardiologist or a gastroenterologist or a rheumatologist. But how do you think, I guess, the role of technology or applications like Guava can, I guess, help people when interfacing or interacting with providers and helping those providers better interpret patient information?
I think similar to how I mentioned before, evening the playing field of perception. So bridging that communication gap between how the patient sees, experiences, and tells their story and their information, and how the provider wants and needs to interpret it in the most efficient and effective way possible. Pinpointing those parts of the story that are the things that a provider's brain is trained to look for. Then also being able to really understand their story and understand how it's affecting that patient's life, because two people could have the same symptoms, but it affects their life in different ways. And so the treatment differs because one person might be willing to try much more because it has much more potential to affect their life in a positive way, whereas somebody else, it might be more detrimental to their lifestyle.
Yeah. So how do you personally define patient-centric healthcare? And then on top of that, if you think it's important, why do you think it's important?
I think patient-centric healthcare is extremely important. I know this isn't the real definition of it, but I think the idea of patient-centric healthcare is really focusing on the patient's story and their lifestyle around their conditions and what they're experiencing. Because like I just mentioned, it really affects how they want and how they need treatment. I think the goal of healthcare and a doctor's job is to help people. So understanding what the patient wants, putting aside what they may need, is important to first and primarily understand how they're approaching and thinking about it. If someone is not ready to be treated, that's going to be way less effective than somebody who is ready. So maybe even though, one treatment option might not be the most effective, it might be the best option at that point because that's what the patient's willing to try at that point, because maybe they need to develop that trust. Maybe they need to develop that relationship before they jump into something bigger.
Yeah, that makes sense. Do you have any suggestions, I guess, for other people who are kind of just starting out in their journey and feeling self-conscious or anxious?
Those providers, as hard as it sometimes is to think about, they have hundreds of patients. You're just one other person in their day. And so you're the one that has to be happy with the process and the treatment, not them. So yes, they know the information, you should listen to their advice, but you're the one that has to be happy with it. And so sometimes I've had to do extra research or ask extra questions that maybe don't affect the way I'm being treated, but I need to know the answers in order to be happy and content with what's going on.
Yeah. From the other side of that relationship, do you have any suggestions or insight for the providers who are handling or trying to help people who have complex conditions?
Yeah, I'd say prompting those kinds of answers, and sometimes patients don't want to bring it up or they don't feel comfortable doing it. So asking them more about what they're thinking, what their intention is coming in, how they feel about what's being discussed, how they feel about the treatment options, if they want more explanation, if they want to understand how more things work. Because, even if I think some patients don't want to ask questions about maybe the more detailed biological, of how things work, because they don't think they can understand it. But I think that's actually kind of not related. It doesn't really matter if you don't understand. Sometimes just being told it is helpful to be like, okay, I'm in the loop, even if you understand one small part of it. When I'm taking a medication, I ask the doctor to explain exactly what's happening on a molecular level. Yeah, maybe I understand half of it, which maybe is more than a lot of people. But the fact that I understand some of it really helps me. And then when I'm taking the medication, I'm not just taking a pill. I'm being like, okay, this is what's actually happening in my body. And it feels less scary and it feels less weird.
Yeah. I think that's a good call out, because it's a forcing function to have people be active participants in their healthcare and also feel like they are a partner with the provider. And from the providers that we've chatted with, they're so sympathetic and they're very empathetic to what patients are going through. But to your earlier point, they see a dozen people a day, hundreds of people a year. And so it's really kind of up to the patient to lead that empowerment or that understanding of no, there's something wrong and this is what I want to talk about. And then it's up to the provider on the other end of that to listen and help facilitate based on their knowledge and involve the patient more with those decisions. So a fun question for you. Do you have any, advancements in technology that you have been keeping your eye on or are interested in to see how it kind of changes the healthcare ecosystem?
I think just generally the idea of interoperability, which I think Guava's definitely working towards. I think a lot of times interoperability is, especially to people who are like half in healthcare, is, oh, that just means data and that just means EHRs and that just means on the provider side. But I think there's a lot of benefit for patients as well. My records are all over the place. Even, I have all these different methods of tracking things. I still don't know what I have, what I don't have, where things are. And I think technologies like Guava that are bringing that information together is really helpful, because there's so much technology with AI developing where it can take that data and come up with really amazing hypotheses and insights, but you need the data. You
Yeah.
can't have the benefits of the artificial intelligence or similar technologies if you don't have the data in one place in an easily understandable and digestible way for those systems to use. And so having something like Guava where, everything is being funneled to one place allows us to actually utilize those technologies, because I think there are a lot of amazing technologies that are coming out, but we need something to bridge that gap to actually be able to utilize it in the most effective way.
Well, thank you, Jenna. Have a great rest of your day.
Thank you.